for 13 years. So when you're seeking out an acupuncturist, you'll be finding someone that is a licensed acupuncturist. So my training is I started at the University of Minnesota and I was pre-med with a biology degree. Then once I completed that, I moved out to Portland, Oregon and completed my 4-year master's degree in acupuncture and herbal medicine. Then after that, I studied in China and Korea. So I have a lot of training working within hospital settings and treating patients from all walks of life. So that's really important when you're finding your acupuncturist is, do they have at least 3,000 hours of training in order to best support you? And I have about 4,000 hours of training. What are the learning objectives for today? I want to talk a little bit about what is acupuncture and how does it work, some current research on acupuncture, my clinical experience and what I found is helpful for patients, as well as how to access acupuncture at Mayo Clinic and how to access it in your community. It's important to know the different options for you and see what works best. So what is acupuncture? That's the big question. We don't fully understand all the ways that acupuncture works, but we do know that it reduces inflammation, helps increase circulation, and because of that, it reduces pain. It's releasing endorphins through your treatment. And so that in turn helps the whole body feel better. Some studies show that it helps to release serotonin and dopamine, as well as oxytocin. And so acupuncture is working on the whole body to help with pain, stress, anxiety. And so when you come in for a treatment, it's really relaxing and soothing. What does the treatment look like when you get acupuncture? So what it looks like is you'll go in and see your licensed acupuncturist or certified medical physician that does acupuncture, and they'll do a detailed medical history. So during this detailed medical history, they will ask you what your symptoms are. And since we're focusing on oncology, they'll talk to you about what your treatment plan is. Here at Mayo, we have access to all of your medical record. And so we'll have a lot of that information beforehand. But it's important to go to your acupuncture appointment with all of that information. That way your acupuncturist can help support you to the best of their ability. So in that detailed intake, we'll talk about digestion, energy. Are you feeling anxious, which is completely normal to have that anxiety during this really difficult time? Where are you having pain, if any? Are you having insomnia, dry mouth, neuropathy? What experience are you having with chemo and radiation? Or maybe you're done with your treatment protocol and are just not feeling like yourself and you want to start feeling better. Acupuncture is such a great way to help with that. So during that intake, we as acupuncturists will start to think about what is your Chinese medical diagnosis, which is a lot different than the Western medical diagnosis. So in Chinese medicine, if you're having pain in certain areas, then we know, okay, I may needle that area where you're having pain, along with needling other parts of the body. And so I will have a clear idea of what points I want to use. And what is it doing during the treatment? Well, once I get that diagnosis and decide which points I want to do, then you'll lie on the table, either face up or face down. Typically, my treatments are face up for treating oncology support. And then I'll do points typically from the elbow down, knee down, maybe on the abdomen, and maybe on the scalp and the ears. So most of the time you can stay completely dressed. Then once the points are placed, you might get maybe 10 to 30 acupuncture points in the body. Then you get to rest for about a half an hour. So during that resting time is when your body really starts to unwind and heal. And as I mentioned earlier, those endorphins are released, those natural hormones are released to help you relax and feel better. And you may have heard some buzzwords called qi and yin and yang. What are those? Essentially, that's your body's natural energy, circulation, and nervous system just working to get back into balance to support yourself. And we all can treat almost any condition. Acupuncture is really safe. And if you guys have any questions, just please feel free to ask at any moment. So a lot of people ask me, well, how do you find these acupuncture points? And does acupuncture really work? Yes, acupuncture does work. It's awesome, I promise. And it's really comfortable. And so When you come in for a treatment, your acupuncturist will feel on your body and use your body's own anatomy to find these points. And how did acupuncture come to be? We don't really know, but we do have a whole measurement system for the body mapped out. And everyone's body is unique, right? All of us have different anatomy, but within our bodies, we all have that same measurement system with finding the acupuncture points. So an acupuncture point I'll talk about a lot today is called PC6. And PC6 is found 3 fingers down from the wrist, right in between these tendons here, right where I have my heart tattoo. That's where you find that point. And so everyone's body is slightly different. So your 3 fingers will be a little bit different than your partner's, than your daughter's, than someone you know. And so when you come in, I'm moving along the body to find those different acupuncture points unique to you based on maybe 3 inches from the wrist or based on different bony landmarks on the body. Or as I'll talk about later with neuropathy, I might do points between the fingers or between the toes. And so it may seem random, but it's not. So on this slide, you can see Meridian Man here. And Meridian Man is showing you most of the acupuncture points in the body. And why is he called Meridian Man? Well, meridians are these invisible lines in the body that we use as a measurement tool once we have formed that Chinese medical diagnosis that I mentioned earlier. So let's say you're on some pain medication and that's causing a lot of constipation. Well, you might have a diagnosis that includes the stomach. And then I think to myself, oh, let's do some points on the patient's stomach, on your stomach, to help with digestion, to get peristalsis moving, and to help you have a better flow. So I may do points on the abdomen as well as points on the legs. And as you can see on Meridian Man, there are a lot of points on the abdomen. And that's where it's important to have that correct Chinese medical diagnosis. That's why we went to school for a long time, to not only find these points, but to get the accurate diagnosis to best support your body. So patients that come in for constipation may have different points than someone that has diarrhea. Or if you're having a lot of headaches, then we do different points as well. So it's really catering to you and your needs. That's why it's important to see someone that has oncology training. So these are acupuncture needles from a long time ago and not what we use right now, which is good because these look painful. But back in the day, they would use bamboo needles, they would use bone, stones, and acupuncture needles now are really small and safe. And you can actually put many acupuncture needles within a hypodermic needle. And as you can see, the one with the blue handle, that needle is really, really, really tiny. And those are the types of needles that I like to use because I find that most patients are already in pain and we want to help you feel relaxed without adding more discomfort when you come in for acupuncture. So my treatments are very gentle, very relaxed, and that's how most oncology acupuncture treatments should be. When you go in for your acupuncture treatment, you may also have some other integrative therapy options that your acupuncturist wants to try for you. And so then, as you can see, there's some acupuncture points there. In the bottom right, you see the knee hooked up with some electrostimulation. And a lot of times that's used for pain and for treating neuropathy. So let's say you come in and you're having pretty significant discomfort. Maybe you're still doing chemo or radiation. Maybe you're done with treatment and you're just not feeling like yourself and you're needing some more pain management support. Once we do a few treatments with acupuncture only, we may find, oh, let's step things up to the next notch and try and get even more pain relief. Then we may hook up the needles to the TENS unit, which can then help with pain management. So that will feel like a gentle current, kind of a tapping. Some of you may have had that with chiropractic or physical therapy, where normally it's patches that we put on the skin, but with acupuncture, we hook up the actual needles to that electrostimulation, which causes sometimes the muscles to jump and we force that relaxation. Then we also use heat lamps which keeps the body warm. And in some clinics, they may use moxa, which is that incense looking stick in the bottom. And what that can do is warm the body up, especially if you're feeling really cold, or maybe you're not noticing a lot of thermal regulation with your body. Maybe you're often hot or cold, and the body just doesn't feel like it can regulate itself. Or maybe you're having some hot flashes from being on different types of medication. Acupuncture can help with that, and moxa can be supportive. We don't do moxa at Mayo currently, just because the scent can be a little bit strong. So that's not going to necessarily be ideal for someone that has a scent sensitivity. As I touched on a little bit earlier, the acupuncturists that you see should have significant training. This is really important. It's especially important when working with oncology patients, such as yourself or someone you know. So we want your acupuncturist to have that additional training to best support you. And why is that? We just want to keep you safe. We want to keep you feeling relaxed and good. Acupuncture in and of itself is very safe, but with oncology treatment, sometimes that means there's surgery where lymph nodes are removed and different parts of the body are changing because of working on that treatment within that way for your body and your unique situation. So if someone's had a mastectomy with some lymph nodes removed, then we're going to treat a little bit differently than someone that has not had lymph nodes removed. So that's why it's important to talk to your acupuncturist and say, hey, I had this treatment, had some lymph nodes removed, so we need to be extra careful in this area. Or I treat a lot of patients that have neck cancer and have lymph nodes removed here. That might mean that I don't do any points on the head. I just do points chest down. Or if a patient has had significant lymph nodes removed in the armpit, that may mean that I don't do any points on that arm. So it really depends on what your treatment protocol has been thus far. And that way we can support you to the best of our ability. So acupuncturists should have at least 3,000 hours of training. They may have also had herbal training, but in this situation, I would not recommend herbal medicine while doing chemotherapy and radiation. It might be an option after you're done with treatment, but during active treatment, I do not recommend herbal medicine. And that's our stance at Mayo Clinic as well. It's great to work on the body with healthy diet, reducing sugar, that sort of thing, but supplements aren't necessarily recommended, and it's best to talk with your physician about that and your acupuncturist. And at Mayo, we also have physicians that do acupuncture in addition to us licensed acupuncturists. So they will have 300 hours of training, and a chiropractor will have about 100 hours of training. So let's say you're in a small community, you don't have a licensed acupuncturist or a physician that does acupuncture, then see if your chiropractor has additional oncology support training. They might be the best option for you, but make sure that they have experience working with cancer patients to see if they're the right fit. And maybe they have minimal experience, but they know how to treat nausea. Then go in and see if they can do some nausea support. That might be the way to go as well. And how might acupuncture work? As I mentioned earlier, we don't fully know, but because of recent research, we do have some ideas on how it may be working in the body. So when there's a lot of stress and the body's constantly in fight or flight mode, your sympathetic nervous system is overfiring and is constantly going. So with acupuncture, we want to calm and relax and tap into that parasympathetic rest and digest stage. And so that's why acupuncture is so relaxing and helpful, is once the points are in, then you get to rest for about a half an hour. So that time is strictly for yourself to unwind. My patients love it. They say it's the best appointment that they have because they can go in, maybe feel stressed, anxious, or in pain, and leave feeling better and relaxed. So that's why we want to be able to support you during this time. And other ideas on how acupuncture may work is releasing endorphins, those natural painkillers. Acupuncture is also going to be helping with nerve regeneration. That's cool research that's coming out. By reducing inflammation and increasing circulation, we can work on any part of the body. Other cool research that's coming out, and I think a really next level research, is when we do needles into the body And then we activate those needles. Imagine I have a real needle here. I'm using a pretend needle that I put into the body. And then that connective tissue spins around the needle and starts to talk to other parts of the body. And so that way, a needle here maybe will interact with a needle here, which is really cool and a great way to treat that pain. And I just find it fascinating. And so I'm excited about new research that's coming out. And so we find that, as I mentioned earlier, these hormones are released. We're working on the pain centers of the body. If you have, let's say, tight knots in your shoulders, acupuncture can help to release those tight knots, sometimes called trigger point acupuncture, which we can do if appropriate during your treatment protocol. So when should you come in for acupuncture? That's a great question. I have a lot of people asking, okay, how many appointments do I need? How often do I need to come in? Well, when we're working with you on your cancer journey, what I recommend is patients come in every week. Every week is going to be the best treatment protocol for you because we're able to build up. Each treatment builds upon the previous session. And so it has that cumulative effect to really help you feel better. Most people are anxious and stressed and nervous, which is completely understandable during this hard time. Or maybe you're a family member of someone going through cancer treatment. It's hard to see our loved ones in pain. And so with acupuncture, it helps to keep the body relaxed and de-stressed as much as possible. What else can it treat? Nausea or vomiting. Acupuncture works so quickly for treating those conditions. Fatigue and brain fog are big ones that I see during treatment and after treatment, that chemo brain that a lot of people have, especially when going back into the workforce after cancer treatment. People are feeling tired. They might not feel like themselves. Acupuncture can get you back to feeling good and feeling more like yourself again in a really safe manner. As I mentioned earlier, neuropathy is a big one I treat. And if we can get you in and getting acupuncture for your neuropathy, then we can stop it in its tracks or help slow it from progressing. Let's say you didn't know acupuncture was an option for you and you went through chemo and radiation treatment. You have really bad neuropathy and maybe you're 3 months out since treatment and you're feeling this numbness and tingling in your hands and feet, which is what neuropathy is. And you say, gosh, I am not feeling good. I didn't know acupuncture was an option. Let me give it a try. And I find that patients get significant benefit even if they start after their treatment protocol. And later on, I'll show you a picture of what that looks like in treatment. And here you can see a picture of the ear. Why did I include that? Well, I wanted to show you how small the needles are. These are my go-to needles. They have the red handle, so different than the blue ones I showed you earlier. These ones are even smaller. And we use the ear a lot of times for stress and anxiety support. And I touched on this earlier too, but I have a lot of patients. I treat mostly breast cancer patients, and a lot of them are experiencing hot flashes or night sweats. Acupuncture is a great way to help regulate body temperature. Maybe you're waking every night and just taking your pajamas off, but then you get cold quickly. So you're putting the pajamas back on. Acupuncture is awesome for treating that. And so typically when patients come in, I say, let's do weekly treatments. But if that's not available to you, maybe you're only in town for a short period of time, or something like that, or after you have treatments, you're wondering how many appointments to do. I tell patients to have 6 acupuncture treatments to see how you feel within that time frame. Most people notice changes with their symptoms within 1 to 3 visits, and then that cumulative effect starts to build up. So we know within 6 how you're going to respond. Most people feel amazing and notice a lot of change, especially if we can get you in 1 to 2 times a week. A lot of patients ask when they should come in when they're doing chemo and radiation. And I've had varying answers from patients. I have patients that see me before chemo or after chemo, and they all say it helps regardless of when they come in. I do find that some patients are not feeling the best on day 2 or 3 after chemo. And so sometimes they like to just stay home and stay in bed and get treatment either before that or after that, which is completely understandable. Do what's best for your body. If you're already coming in for treatment, come see me that same day. That way you don't have to leave your house the next day if you're not feeling very well. So it's finding that sweet spot for you. So this is a big slide and I'll break it down and say that what we found with acupuncture for treating nausea is that it works quickly. 97% of patients found benefit with using acupuncture for nausea relief. That's a lot. It helps quickly. And what are we finding? We're finding that when you come in once every 9 days is what this study did, but come within 5 days of chemotherapy and come in every 9 days and we can keep the nausea away, and it works really well within that time frame. This study found that after that 9 days, the efficacy did start to go down. That's why I recommend the weekly treatment. And what we found is that acupuncture also works great with Zofran, which is a medication that can help with nausea. So when we marry acupuncture and Zofran together, you get the best benefit versus Zofran by itself, which is super helpful to know. And so this data just backs up what I said earlier on the weekly treatments to help support your body. So here's some cards that I typically give out when we're able to do person-to-person presentations and I get to meet everyone, which I miss doing. Hopefully one of these days soon we can be back to in-person presentations, but I'm really happy we're able to do this via Zoom. So what you can do is go back and screenshot this, maybe when it's on YouTube, to get the names of these acupuncture points. And these are actually also great acupressure points. So what is acupressure? Something that you can do on yourself or a partner, or your acupuncturist can do on you if you're a little bit nervous about needles. And as I mentioned earlier, that point that's on the wrist right here is called PC6, that acupressure for nausea. Then we have mental fogginess, so that brain fog I mentioned earlier. It's a point on the top of the head. And something that's really fun that they teach in Qigong is tapping the top of the head like this to help give yourself some energy. I think we could all use that right now, right? It's the afternoon. And so that's a nice way to just give yourself a boost. And then fatigue, there are some points listed there as well. As you can see, acupuncture, you just need to do a few points sometimes to really help yourself feel better. So as I mentioned earlier, acupuncture works really well for neuropathy. And what we found with research is that in this instance, it's not necessarily working on endorphins, even though that's what is released during treatment. It's working on nerve regeneration, which is awesome and super helpful. And actually, I don't have a slide for this, but I treat a lot of patients that have scar therapy, patients that have had surgery and are maybe noticing some adhesions on where those scars are. I can do scar therapy, acupuncture around those scars, not into them, but around them to help wake up the nerves and help with any numbness or pain associated with that. And so with acupuncture, we're always working on the nervous system and we work on nerve bundles, but we don't want to needle into the nerve aggressively. That does not feel good, and that's not what we're looking for. So when you get a treatment, we'll put the points in. You might have a little dull, achy sensation during the treatment, but we don't want any sharp shooting discomfort that lingers. That's not what we're looking for. And so that's why it's important to find a provider that has a lot of training, that way it's comfortable for you. So this is an image of acupuncture for neuropathy. So it may look a little bit scary, but I promise it's not. Most patients don't even feel these points, especially since you already have some numbness and tingling that may have started. So with acupuncture, you may find that you come in and your hands and feet are really numb. And then literally at the end of the treatment, you can feel. And I see my patients doing this all the time, where they say, oh my gosh, I can feel my fingertips, which is awesome and amazing that you can notice it that quickly. And so that's why we love acupuncture so much, is because you can notice these fast results. And again, really safe. Here's some more acupressure cards that I like to show. And you'll see that some of these points are appropriate for a few different conditions, like headaches. This is a big one that a lot of people may have seen before. Here, that's a better way for me to show you guys. And so pressing on this point pretty strongly is great for headaches and stress. And this acupuncture point can sometimes be a little bit tender. So as I mentioned earlier, points are based on anatomy. This is a big muscle group right here, and a lot of people have tension in their hand. Some points you might feel a little achiness there, but that achiness is a good thing. And so when you're doing acupressure, this hurts when I do this right now, but I know it'll relieve my headache and even help with hand pain if I'm having that. And one of my favorite things to treat is anxiety. And so that's why I said at the beginning of this presentation is this presentation is for everyone, because most people have some sort of pain, anxiety, or stress going on. And so these points are appropriate for anyone coming in to see me, whether they're going through cancer treatment or a family member of someone going through cancer treatment. Okay, so I want to talk about cupping because I love cupping and it's something that you may have seen before. Cupping is not always appropriate during cancer treatment, but cupping may be appropriate after you're done with cancer treatment. And so it's a great way to release that muscle tension, relax the body. So what is cupping doing? We know a little bit more about what cupping is doing. Unfortunately, we don't have a lot of research on cupping, but we have a lot of clinical experience, and I can tell you what most patients notice. So with cupping, and pretend I have an imaginary cup. You put the cupping on the skin and we pull the skin up into the cup. What's that doing? Well, we find that oxygen is then, let me back up a little bit. Once we pull that skin up into the cup, it's pulling apart those muscles and that fascia. So let's say I have a really tight knot right here. When you have that tight knot of tension, you're not getting oxygen in there. You're not getting as much circulation as you could get. So the cupping opens that area up and you can get more oxygen and circulation and blood flow, and that breaks up those tight knots in order to help you feel better. And so cupping can leave circular bruise-like marks on the body when we're done, because we're pulling apart, releasing that tension in the body. And the darker the mark, the more tension you have in that area. So I see pale pink to black marks on the body. And the more cupping you do, the less dark the marks are. And so for us, it can be a really diagnostic tool in order to help us see where you're having the most pain, maybe where we want to put needles afterwards, and how you're progressing. Also, if you get cupping and if you have no marks, that might mean it's more of a skeletal issue or bone issue versus a muscular or fascia issue. So it's really interesting. Feels great, but again, not always appropriate if you're going through radiation treatment, chemo, and depends on the type of surgery you've had. If you've had a mastectomy recently, again, with a lot of lymph nodes removed, this may or may not be appropriate for you, but I wanted to share it because it's really fun and interesting and a great way to treat pain. And so I wanted to share with you guys on how you can receive acupuncture at Mayo Clinic. So acupuncture's been here for around 12, 14 years, and we're super busy and we love treating patients, and we get a lot of patients coming in for oncology support, or like I said, family members of those going through treatment. And we have an outpatient clinic where you can get a referral from your Mayo Rochester physician. And once you get that referral, then they'll put you on our schedule here in the clinic and we can bill insurance. If your insurance does not cover acupuncture, then you could see me at Rejuvenate Spa, which is within the Mayo Health system, and it is a cash-based practice. So here at Mayo, we're all employees that work to help support you and help you feel better, but we have a few different avenues of how we can do that. So insurance-based outpatient clinic with an order. Let's say you're inpatient and wanting acupuncture support while you're in the hospital. Again, you can get that order and we may be able to bill insurance. And then let's say you don't have insurance coverage and you want to pay with cash, and you can see me at the Rejuvenate Spa, as I mentioned previously. And something I will mention is some patients like to have everything done within Mayo Clinic themselves. And some people say, you know, I love Mayo to pieces, but I just want to go to the spa to get my acupuncture treatment. And we're a building just a few blocks away. And some people like having that separate experience in the spa because for them it can be a little bit more relaxing. And then when they come in after their treatment protocol is done, they have such a great relaxed feeling about going into the spa because they know they're going to leave feeling better. If you're seeing an acupuncturist back home, that might be in a private practice setting where they may or may not take insurance, or it might be in a hospital setting where they typically can bill insurance. In a lot of smaller communities, it's often going to be cash-based and where you pay at the time of service. Every clinic charges different amounts, but typically the initial visit is the highest amount. So maybe it'll be $120 for an initial visit or $100, and then follow-up will be a little bit less. So what I urge patients is to give it a try. Try 6 sessions and see how your body responds. Let's say you go to an acupuncturist, maybe you Googled it, in the community to see who is available for me in my community, who should I see. If the hospital has acupuncture, definitely go to the hospital first. If the hospital doesn't have acupuncture available, who has some great reviews online, or who has a family member seen for acupuncture? Find someone that feels comfortable to you, someone that you can talk to about all of the emotions you're feeling and the pain that you're feeling, and build that connection and relationship with that acupuncturist. Or if that's not important to you to build that connection, that's okay too. You can find someone that's nearest you, go in, get started with a treatment, and you don't have to talk. Really, this is all about what's best for you as a patient. And what I tell patients is, if they're in Rochester, come in, see me, let me show you what an acupuncture treatment should feel like. And then when you find someone back home, you'll know if that's the right fit for you. And if you see someone once and you think, gosh, I don't know if I like that or not, maybe find a different acupuncturist to see if you connect with them better. But treatments may have a little bit of pain every now and again, but shouldn't hurt, shouldn't be too uncomfortable, unless maybe you're working on a really tight muscle in the back that needs to be released. It should just be a really relaxing and supportive treatment for you. So here's a picture of me working at Rejuvenate Spa pre-COVID times. I miss seeing patients' faces, but of course, very supportive of wearing masks. And so if you're getting an acupuncture treatment now, we wear masks and we don't do points in the face. But I wanted to show you a treatment protocol here of me doing some acupuncture for facial pain or sinus congestion, maybe some TMJ going on. And it's a very relaxing experience. And then in the outpatient clinic, this is what a typical treatment room looks like, where we have relaxing music playing and it's really warm and supportive. And typically acupuncture treatments are about an hour long, which is a nice time to unwind and decompress. The advantages of acupuncture: feels awesome, super relaxing, and is really safe, minimal side effects of acupuncture. And it really has a holistic benefit to the body. Mind, body, spirit can just feel relaxed. As humans, we have so many elements to ourselves, right? We have mental, emotional, spiritual, physical discomfort. And when things are out of balance, we just don't feel like ourselves. And so acupuncture is such a great way to get things back into balance. Typically low cost to treatment. There are some cities that have group acupuncture, which may be a great option for you. That's where there's going to be maybe 5 to 10 zero gravity chairs within one room, where you get treatment along with other people that maybe are also cancer patients, or other people that are having high levels of stress or pain. And typically that's going to be a sliding scale. So that might be $15 to $65, and you pay what you can. And in those situations, they're especially great if you want to go in three times a week to have it be more affordable. So there's private room acupuncture, as I showed you earlier, private room, or the group acupuncture. Both are great options. Do what's best for you and within your budget. Typically, group acupuncture isn't really seen in the hospital setting, but we're hoping to change that and get more group acupuncture options here. Fingers crossed on that. And so, as I mentioned earlier, maybe cash or insurance based. Thankfully, within the past 2 years, Medicare is now covering acupuncture for low back pain. And so that can be an option for you as well. But a lot of times private practice clinics are cash based only. All right, that is my presentation. Thank you for listening. I hope I didn't talk too fast. Are there any questions for me?
Thank you, Sara, for all
You're
of
welcome.
that great information. We do have some questions, and I'm
Okay.
glad that we have some time to be able to address them, but just wanted to say how it's really impressive how individualized each session is, how much training that you have. And I love how integrative medicine is being recognized much more so as a way to treat people, or a way to couple symptoms along with some medications that people take, like
Yes.
you had referenced before. So one question is, do you need to do anything pre and post treatment? So
Mm.
if you're going to receive acupuncture, is there anything you need to prepare ahead of time or plan for after treatment?
Thank you. That's a great question. So beforehand, I just recommend people have some food in their stomach before acupuncture. Within 2 to 3 hours, try and get some food in. I don't recommend drinking coffee right before acupuncture, just because that can get you more energized. Whereas with acupuncture, we want you to feel relaxed. And why do I want you to have food beforehand? Just because sometimes people can get a little bit lightheaded or dizzy if they have an empty stomach. And so that food in your stomach will just help the body feel more grounded and relaxed. And then typically, I recommend people relax after acupuncture. Most people feel kind of floaty and relaxed. A lot of us have had massages and know how it feels to be relaxed after a massage or after yoga. Acupuncture is a similar feeling where you just feel really calm, and that's that nervous system having been really relaxed by the protocol that we do. And so I recommend coming in, having eaten some food, and afterwards having about half an hour to an hour to just unwind and relax. So don't go into running errands right away. Don't go into a workout right away. Typically, I don't recommend people work out within a few hours after an acupuncture treatment. It's because we want to really assimilate that treatment into your body. So if you're relaxed, I don't want you to force yourself to go do a lot of work afterwards. And so it's a good day to just rest.
I say you may as well maximize the benefit and bask in that
Yes,
afterwards. So if you
exactly.
can adjust your schedule to do that, that's wonderful.
Exactly.
Um, so another question is, why doesn't most insurance cover acupuncture? And you kind of talked a little bit about how Medicare is doing it. So I don't know if it's most or what you really see, but do you have any insight as to why maybe some insurances don't cover the?
That's a that's a great question. I think it might really depend on where you live, because in Minnesota, a lot of our patients do have insurance coverage. I find that more and more insurance companies are covering acupuncture, whether it be a dollar amount or a treatment plan amount. So I can't fully answer your question because I don't know why. I wish insurance companies would cover acupuncture. It might just be, I don't know why they don't cover it.
Yeah,
For some people, it's, hey, let's have more research and then we'll cover it. But there is a lot of research out there, so I don't fully know.
sure.
But a lot of patients have like 12 treatments a year that they can get. And then Medicare, don't quote me on this, but it's either 8 to 12 treatments. And then if patients find benefit, then it's maybe another 8 treatments. And so I find that
Yeah.
most do cover it,
Okay.
but private practice may not take insurance. And so that can be a big thing
Sure.
that can be a
Right.
challenge. Yeah,
Depending on where you're receiving treatments at. And I think that
exactly.
is a frustrating thing with insurance across the board, how
Yeah.
one plan is not the same as the next plan as
Mhm.
the next plan with a variety of different treatments or procedures of that sort.
So
So
true.
on this same vein, what is your experience with Mayo Insurance being willing to cover treatment? Do you
Mayo
know about that?
insurance is awesome. Mayo
Okay.
insurance is awesome. We're really lucky here. So our Mayo insurance covers 20 visits a year.
Okay.
So,
Good.
which so grateful for. Yeah,
Good
20
to
visits a
know.
year. Mhm.
Okay. So here's a question that is going to the famous. So are you related to the famous Dr. Bublitz in Colorado?
Oh, I don't think so. No,
Okay.
I wish I was. So
And
I like
then
that he's famous. Sounds
yeah,
amazing.
puts you a little
No,
bit
I'm
closer
not.
to someone who's famous with the same name, right? Um, can you refer to someone in Colorado, or is there any place people can go? You kind of had referenced talking to family members or different people
Yeah,
doing some research. Is there any kind of website, or where would
yeah.
someone maybe try to find a provider if they're not close to Rochester, Minnesota?
Great question. And so I really recommend people kind of seek out acupuncture within their community. And another great resource that people can use is nccaom.org. Org, which is our board certification body, where you can type in where you're located, and then it will show you the acupuncturists in your community that are board certified. Sometimes it's not as always up to date on necessarily what clinic they're working at in case they've moved to a new clinic recently, but nccaom.org is a great place to look. And there are tons of amazing acupuncturists in Colorado. And so, as I mentioned earlier, look online, talk to family members. And some areas might have more sports medicine focus, women's health focus, oncology. So really quiz your acupuncturist when you call them. Just say, hey, I'm coming in with this. Have you treated this before? And if so, how comfortable are you treating this condition again? Really interview your acupuncturist. That's completely appropriate to do because we want you to find the best person that you can find.
Sure. Thank you. All right.
You're
So I
welcome.
am a past cancer patient, but would like to consider acupuncture for chronic neck pain,
Mhm.
headache, and anxiety. How do we proceed for an appointment in this treatment and get insurance coverage for treatment? You've kind of alluded to this a little bit, but I thought even just those specific symptoms sounds like
Yeah,
something that acupuncture would potentially address.
definitely. So I guess my question is, are they looking for at Mayo Clinic or within a specific hospital setting? Do you
That
know?
that part wasn't defined. You
Okay.
did reference about how to do that within Mayo. Can a patient self-refer or do they need a
No.
referral from a
Well,
provider?
good question. Depends on the hospital. So here at
Okay.
Mayo, patients can self-refer to the spa. The spa does not need an order or referral, but that is cash-based. We do not deal with insurance at the spa.
Okay.
Versus within the clinic, you need to get that order from your Mayo physician. So let's say they're looking here at Mayo. They live in Rochester or nearby. They have neck pain. They just need to say to their primary care physician, hey, I've been having a lot of neck pain. I hear acupuncture can be supportive. Can you write me a referral? Or wherever they're living, that's a great question to ask their primary care provider. If it's someone that's in a private practice, they do not need to get a referral or order from a physician.
Okay.
So only in the hospital setting. And then treating pain, it's so easy to get coverage from your insurance for treating any type of pain. That's where we can get the most coverage as long as your insurance does pay for acupuncture. And and so I treat, within the clinic, the number one thing we treat is pain, back pain, neck pain, any sort of pain that you have. Acupuncture works great for it and would be completely appropriate for you to do. Also, if you're having some brain fog after your cancer treatment, then acupuncture is a great way to help with that, or insomnia, that sort of thing.
Sure. Here is a question asking, can you compare deep tissue massage to cupping?
Mm, they're really similar. And so I actually compare those two regularly. So that's a really great question. And that's very astute on your part because with that deep tissue massage, it's really getting in there and kneading. And cupping is really similar. It's just the inverse of that, but they're doing a similar thing. And actually, what I recommend my patients do is come in, get cupping so we can pull apart those tight knots so that when your massage therapist goes in there to do the deep tissue massage, they can break up the knots even better and you get even more benefit. So I find that cupping helps to support massage or chiropractic care or physical therapy even better because we're able to break that area up and then start the healing process faster. So they're
Sure.
really similar. On that same note, I should mention, just like deep tissue massage, sometimes cupping can leave you a little bit sore and have you feel like you just had a workout. That is completely normal. Some people have soreness the first few times and never again, and some people are never sore.
All right. Thank you.
Mhm.
And here's another one. What, with chronic documented medical record of neck condition problem, is our Mayo insurance more apt to cover if my family med doctor recommends?
I find that Mayo Clinic insurance covers any type of pain, anxiety, infertility issues. I have not come across Mayo insurance not covering treatments for people. That's a great question because we treat patients with Mayo insurance all the time, and I have not come across any issues, especially if you're having pain. So that shouldn't be a problem at all. And like I said, even infertility, we can get coverage for that, or anxiety, nausea. Um, Mayo Clinic is really, Mayo Insurance is great on that.
That's good to hear.
I would hope
Yes.
that most insurance companies would be that way, but I can't speak to all of them. But pain is definitely going to be covered by most insurance if they cover acupuncture.
Okay. So here's one related to neuropathy.
Hmm.
I have severe neuropathy from the chemo treatment. Would you suggest trying even if you have had ongoing neuropathy after treatment? I asked if there was anything I could do as it was becoming a problem, but this is the first time I'm hearing about this.
Mm.
So first time hearing about acupuncture as maybe being a solution.
I'm sorry that you're having that neuropathy. It's hard. I have a lot of patients that did not know acupuncture was an option, and typically patients get a lot of benefit. We may not be able to reverse the neuropathy that you're experiencing, but acupuncture can definitely help with the numbness and tingling and help to support the body for if not just a few days, but for a few weeks. Really depends on how long you've had it. So let's say you have been done with treatment for a few months. You're going to notice more changes typically than someone that had treatment maybe 10 years ago. So the longer the time in between treatments, and starting acupuncture, kind of the benefit goes down just because of nerve damage. And
Mhm.
so I say try it, try 6 treatments, try the points between the hands and the toes. They don't hurt, I promise. Those might also be hooked up to electrostimulation as well, just to help get more pain relief. And so without getting into specifics, I have patients where we start a few months after and their neuropathy completely goes away. I have other patients where I have to see them every 2 weeks because the treatment helps for 2 weeks and then their symptoms start to come back. And unfortunately for those patients, acupuncture is just something that they have to do for the rest of their life, but we know it helps and that's the only thing that helps. So it's worth it to try. I really hope it helps you feel better.
Sure. So now a question about what about diabetic neuropathy? So we kind of talked about chemo-induced neuropathy, but what do
Mhm.
you find with diabetic neuropathy?
Awesome. Acupuncture can be so awesome for it. I find benefit with both types of neuropathy. And then what I find is, again, it just kind of depends on the patient, depends on where they are in their diabetes journey. If how long they've had the neuropathy, if it's years versus months, then that can kind of say how much relief they're going to get, but it definitely is beneficial and research shows that it helps. So, at Mayo, we're very research based, research minded, and the research is out there for neuropathy helping getting benefit from acupuncture. So again, I recommend trying it.
Sure. And it sounds like you're saying early intervention is
Mhm.
better for, like we say, for a lot of different things. Even if it's outside of acupuncture, early intervention does seem to have better results. But
Exactly.
it is good to try. I mean, especially if you're
Mhm.
having neuropathy, if you can
Mhm.
have any level of relief or an improvement, it's likely worth it.
Definitely.
All right. So other comments have just been thank you that this has been very informative and helpful. So I want to pass that on to you. I will say that there is a survey that comes to you. So if you can take the time to fill that out, give us suggestions of different topics to do or feedback on this. And then, like I had said at the beginning, just to encourage you to follow our cancer education blog on Mayo Clinic Connect, because we keep that up to date with future webinars that we have available to you. So I would just like to say thank you, Sara, for joining us today. And thank you
My
for the
pleasure.
patience of our people to recognize that there's not actually two Megan wrestlers, but that's how it ended up being today. So I wish you all a good afternoon.
Thanks,
All right.
Megan.
Thank you. Bye-bye.
Bye.